Cancer, I think
it's the timing of all these studies, guys, that kind of I find curious, right? Is the healthcare debate. You know, it is weird. Right? But thank you both very much.
Thank you.
All right, well, Utah Republican Senator Bob Bennett says that he has a problem with managed care, where life and death choices become government yes and no calls. Senator, very good to have you. These fine doctors saying that, you know, they're worried to the degree that Washington might be able to seize on this and go beyond the bounds of this. What do you make of that?
Well, I always worry about Washington getting in the middle of anything, and certainly as far as the healthcare situation is concerned, that's an area of concern. But frankly, given the mess that we're looking at legislatively right now, we're a long way from having the slightest idea what Washington's going to try to do.
Well, you know, Senator, it is just me, but I see a lot more of these studies popping up at front page stories and elsewhere popping up about the dangers and the shortcomings in our health care and the expense and maybe sometimes the needless expense in our health care. I don't know whether they're timed to a lot of the votes that are going on right now or a lot of negotiations behind closed doors going on right now, but what do you make of that?
Well, the reality is that we are spending too much on health care. That's very clear. Every study, regardless of the specifics, makes that clear. Now, the question is, where can we cut? And that becomes much more difficult to find. It's like Eddie Rickenbacker once said when he was president of Eastern Airlines, we know that half of the money we spend on advertising is wasted. Our problem is we don't know which half. And we know that a third to a half of the money that's spent on Medicare does not contribute to better outcomes, but we don't know which third to a half. We know that a great deal of money is spent on defensive medicine that we really don't need, that we could get rid of if we did something about tort reform, but we're not quite sure which ones specifically to deal with. And the problem is that as far as legislation is concerned, the Holy Grail is the statistical number of coverage. If we can just get everybody covered, we will have solved all our health care problems. And of course, we have de facto everybody covered now in the form of the emergency room, and that's not solving the problem.
But this test, if you take it at face value, Senator, seems to be saying that since most, I think it's 65% of the escalating costs is concentrated in these tests, you know, whether you have an MRI or a CAT scan, a spinal tap, any of that stuff, and that if you could curtail those tests, you could go a long way toward curtailing the cost. Is that the greater aim here?
The greatest cost containment that we've seen demonstrated is quality. The best health care is the cheapest. And it comes out of groups like Intermountain in my home state. HCA has done a great deal of similar work. Mayo Clinic in Rochester. And they're practicing medicine in a different kind of way than the traditional fee-for-service, almost cottage industry of one doctor per each family. And they get a handle on this, and they're able to control cost. But it's very, very difficult in the present circumstance to get that kind of best practice going nationwide, because the way Medicare reimburses and Medicaid, it mitigates against that.
All right, Senator, we'll watch you closely. A pleasure having you again. Thank you very, very much.
Thank you.
All right, well.